8.3% of the American population has diabetes. Out of that 8.3%, only 5% has type 1 diabetes. 1 in every 400 children has type 1 diabetes. My sister is one out of those 400 who has type 1 diabetes. Diabetes is when your pancreas does not produce enough insulin to properly control your blood sugar levels. Diabetes is insulin dependent and considered juvenile because there is no cure. Some symptoms of type 1 diabetes are high blood sugar, feeling tired or fatigued, feeling very thirsty, losing weight without trying, blurry eyesight, deep rapid breathing, dry skin or dry mouth, flushed face, unable to keep fluids down, nausea, vomiting, and stomach pains. Some of the signs that my sister had before being diagnosed with type 1 diabetes are being very thirsty, unable to keep fluids down, nausea, vomiting, and stomach pains. She became very sick and started showing symptoms of type 1 diabetes, which at the time we did not know were symptoms. When her blood sugar became very high, she became non-responsive and had to be rushed to the hospital by ambulance. My mother was told she was in a diabetic coma, which to us made no sense because she had not been diagnosed with diabetes. My sister had a 3% chance of surviving. She spent 3 days in the ICU in a diabetic coma. My sister, like most people, was not diagnosed with diabetes until her early teens. 1.9 million people 20 years or older were diagnosed with diabetes in 2010. Diabetes is a lifelong implication with no cure. And since type 1 diabetes is insulin dependent, people such as my sister have to take daily doses of insulin in order to survive. There are 2 ways for them to take the insulin. The most common way is through a shot in the stomach, the back of the arm, or the leg. The shot must be given in a place that has some body fat. Another way is by using an insulin pump, which is hooked up to their side at all times. The insulin pump looks like a pager and has a tube with a needle at the end of the tube and is inserted into the lower stomach. When my sister was first diagnosed with diabetes, we were afraid she would not survive. The doctor said she only had a 3% chance of pulling through. Her blood sugar level was off the charts of more than 500. The average blood sugar should be between 70 and 120. We spent a week at the hospital with her learning how to take care of her and learning how she would have to spend the rest of her life. If you or someone you know have family history of diabetes, they should get checked out. That was one of the worst experiences in my life, and I am so thankful my little sister survived. For a list of symptoms for type 1 diabetes, visit www.diabetes.org, or you can visit www.ncbi.nlh.gov or www.umm.edu/patent/articles/what type 1 diabetes for more information on type 1 diabetes, because no one wants to go through what I had to go through with my little sister and not knowing that something in their life could change drastically at any time.